We're going to transition yet again. You know, the news earlier this year, or maybe it was last year, I guess, time does fly, that Amazon was going to partner with J.P. Morgan Chase and Warren Buffett's Berkshire Hathaway on a new healthcare initiative to be determined. Well, immediately it sent health insurance stocks and others into a tailspin, because the question, whenever a disruptor like Amazon comes into the picture, you don't know what is going to happen. And that is the topic of our next panel. Let's take a look at what to expect.
The company that has changed the face of retail is now taking on healthcare. Amazon will team up with J.P. Morgan and Warren Buffett to create a so-called dream team with a huge workforce to experiment with. Bezos and company have already primed the marketplace with their own line of private label over-the-counter medicines, not to mention a growing business selling medical supplies to doctors, dentists, and hospitals. The question for everyone in this room is what comes next?
What will Amazon do? They will deliver water if you need it, right here. Our panel joining us today, my favorite Harvard Business School professor, the former CEO of Medtronic, Bill George; Julie Grant, partner with Canaan Partners and a board member of the Biden Cancer Institute; Faisal Mushtaq is Chief Executive Director of Truveris; and our moderator for this panel is Christina Farr, technology and health reporter for CNBC.com. Welcome, everybody. Christina, thank you.
Thanks, Tyler.
Bill, great to see you. Thanks for coming. Faisal, thank you for coming.
Just wanted to say a special thanks to Faisal for being a last-minute replacement for us. So we were so happy to have you here. And you guys, are you excited for the informed speculation panel, as I like to think of it? Because even at this point, it's been maybe a year since I've been reporting on Amazon's plans in the space, and the company has said so little about healthcare and its potential to disrupt this absolutely massive sector. So I thought maybe we could start off by talking through what we actually know at this point, just from, say, looking at the hires that they've made, what's for sale on the e-commerce store and Amazon Prime, and then we'll, of course, get into what they could do with that. So we'll start with Bill, and I'd love you to weigh in on just what do we know?
Well, there's two things we know that Amazon can and will do. The first of all is to their employer. They and J.P. Morgan and Berkshire have 1.1 million employees. They bring other employers in. They'll have 10 million, and they can have much better employer-based health care. And we all welcome this. We want employees to stay healthy and to think about these things and to buy more efficiently. So I think they'll definitely do that. Second thing they can do is use their distribution skills online. Why do we have to go through all these levels of distribution? They'll disintermediate the whole drug distribution system, the supplies distribution. We welcome that to get products much more efficiently to people. And the third thing they'll do is what I call the Amazon catalyst. They will catalyze other people to do something. They're not going to make Mayo Clinic go away, that's for sure. But they aren't going to make United Health Group go away, because United's doing all these things, but they'll catalyze a lot more activity and a lot more direct to hit some of the very important things, value-based health care, and I think they'll also catalyze trying to get employers involved, as I said earlier. And I think most important, as Esther Dyson was saying, they'll try to get us thinking about healthy living and they'll catalyze more activity. So I think this is a very good thing.
And I want to come back to that of who will Amazon take out of the market, because I know you have some thoughts on that. But Julie, you've probably seen as an investor some of the portfolio company executives get scooped up all of a sudden by this company, Amazon, that isn't saying anything. So what's that experience been like, and have you been tracking some of the hires that they've made?
Yeah, it's interesting to live in Silicon Valley right now with Amazon as the giant in Seattle. So what we've noticed is actually Amazon has made a number of hires at the infrastructure layer of technology. So they've hired individuals, friends actually of ours, like Missy Krasner, who previously was working at Box and managing their data for healthcare systems. We've also seen a Salesforce team expand to the life science sector, where they're now storing data for large amounts of genomic sequencing. And that isn't necessarily what we all think about first when we think about healthcare and buying pharmaceutical products online, but it is actually hints of a strategy to have an infrastructure play across the entire healthcare ecosystem. And then also, like you said, Bill, we're also following on their marketplace. What currently can you sell just as a consumer or as the business manager for a small practice online? And if you go on today, you'll notice that actually you can buy a full knee replacement durable medical equipment kit directly for cash without using your insurance today online. And so I think that that's a hint in terms of some of the other sectors they may be looking at, is you're seeing more medical supplies show up on the market.
And Faisal, do you see this more ultimately as a consumer push, or will Amazon, do you think, take on sort of more of the B2B side of healthcare?
Yeah, so I think fundamentally Amazon is a company that's built around supply chain improvement. And with that, I think it makes most sense for them to go in that direction. Based on some of the hires I've seen, I think they're in the process of building a team together of thought leaders to come up with where they want to go first. So it is my view is that they have the enormous potential to aggregate the demand side, which is all the employers and potentially cash pay people. And then all the suppliers, which are the pharmaceutical companies, that would not be talking to anybody on the street, but they would rather talk to a demand aggregator like Amazon that has the ability to interrupt or disrupt the current supply chain without compromising their own revenue stream. So I can't expect that to come from a established healthcare company, because anything they try to change will change their revenue stream. But Amazon and other innovators, could be Google as an example, they have an opportunity to disrupt things because they're not moving any of their cash away from. So I think they have a big play, and I think they're still in the formative stage based on all the people that they've recruited to actually figure out what's good they're going to do. And it may take another many years for us to really know where their first move is going to be.
Just at this point, to remind everyone, if you have questions, to use the hashtag #HealthyReturns, because I'm going to be asking some of your questions later. So which companies do you think should actually be threatened and worried right now about Amazon? Because we've all seen the market, healthcare stocks just tank every time we get a nugget of information. Is that realistic? Should companies be worried inside of healthcare? And if so, which companies?
Clearly the PBMs. We already see Express Scripts make a move and sell out to Cigna. I think that was a move from weakness, not strength. I think they'll both be struggling. I think Medco and all the PBMs, and I don't want to offend all the people in the audience from McKesson and Cardinal Health, AmerisourceBergen, but that's a threatened level of distribution. We don't need all these layers in the system, and we need to do much more directly, and why shouldn't we? I have my prescription from my doctor. Why shouldn't I be able to receive the medications directly instead of going through 5 layers? That's where the cost is. By the way, you heard Dr. Gottlieb say that we're going to push for generics. I think that's terrific, but right now you have a generic that just cut 90% price, maybe 99, but by the time it gets to the consumer, it's up around 60 or 70 cents on the dollar, so you don't get the reduction. That's all the middlemen. We can take them out.
So in your view, we can cut out the middlemen to bring down those drug costs finally? Yes. Julie, do you agree that these companies are the ones that should be most threatened?
Yeah, I would say that those are my list. And I think that if Amazon really creates a new insurance product, which I think is actually very different than an employer and just negotiating regional demand and supply contracted rates, if they really do change the way that insurance is designed and gets rid of the need for a PBM or the need for a third-party administrator, the businesses of the Mercers, Towers, those are intermediaries of their own right. I think it really depends on how creative in the long run Amazon gets when it comes to the B2B pricing in healthcare. Then there's a lot more companies that are potentially up for grabs.
Yeah, my take on this is I think Amazon has already done enough without actually doing anything with all these mergers and acquisitions happening. So my view on this is it is actually Amazon coming in by the actions of health plans and PBMs is essentially has become a self-fulfilling prophecy where these folks are making the lives of employers, the lives of consumers potentially harder to understand where their cost of medicine is, what the cost of health procedures are, because they're going to become more and more integrated. That means the number of people that compete in this business, both for employers, is going to go down. The amount of availability of medicine and services will be restricted because of the very nature of vertical integration. So consumers will end up having less choices, and Amazon will have a much improved thesis of trying to do what I think they should do, which is break up this entire business of rebates, break up this entire business of employers deciding, and by the way, employers don't want to do this, employers deciding what medication you can take and what medications you cannot take. And that entire behavior is revolving around formularies, rebate structures, and most of the progressive employers that we speak to in our business, they don't want anything to do with formularies. So if you remove formularies, rebates go away. And maybe we are looking at a future where there is an open market where employers, maybe way down in the future, there's a spot market for prices where pharmaceutical companies are actually bidding for the business for employer and their patients in real time based on net prices. If you just think about how much money, what the difference between gross to net today is in pharmaceutical drug, it's more than $100 billion of a total spend of $500 billion. So if you think about all the money that's taken out in the middle, that is not going into the pockets of the consumer, it's not going into the pocket of pharmaceutical companies, but it's being taken out by the middlemen that George is talking about. There's at least $100 billion opportunity to optimize that. And Amazon has the potential to disrupt, create the buy side, create the sell side, and maybe open this all up for all of us as consumers.
And you mentioned this term consumer, and I want to fixate on that because we've all had experiences in healthcare as consumers that are lacking where we think this would not happen to me in any other industry. With Amazon's focus on customer experience, where do you think this should go? And I hope someone mentions delivery by drone, because that's how I want my medications in the future.
Well, why not? Why shouldn't they? First of all, we need price transparency, and I think Amazon will bring that price transparency. We need to know, this is the only thing we buy in our lives, and we don't know what they cost. We know what the copay is, that's all we know. And I think the direct delivery has great merit. I have to have a prescription from my physician. Let's get clear about that. We're not doing anything to take the doctor that is prescribing out of the picture, but I think the delivery systems can be much simpler. And frankly, I think people are not going into the clinic nearly as much. They're maybe going to CVS. CVS is not going away, and I'll get my prescription there, but it'll come directly, and it won't be all these middlemen.
Yeah, I think that with Alexa and the Echo being in people's homes, the tech infrastructure and the regulatory environment right now isn't there. So can we get to a place where, every time I say a word incorrectly, Amazon, hopefully Echo doesn't buy me some medication or send me some drugs in the mail? I think that's probably not where we're at right now. But thinking into the future, they have a footprint in the home. And so I think the ability to really have that convenience that Amazon is so exceptional at is critically important. Again, I'm going to go back to plan design, which is a really unsexy topic. But there's a reason that we don't understand the price of what we're trying to buy in healthcare. And a big problem in that is the deductible. Because we don't know how far we are into our deductible and if we're supposed to pay 100% of the cost or 5% of the cost at any given moment in time. And so if Amazon's going to get really advanced in terms of pricing and giving us that transparency, we actually need a change in the insurance product structure. And a self-insured employer with a lot of demand can do that, but it requires a very big change in how we administer benefits. And I think that Faisal was getting at that in your comments of, we have a lot of really broken systems in the US healthcare system that have bad problems, trying to solve bad problems. They really could change that. It's not going to happen tomorrow, but they could basically make PBMs irrelevant.
True. So the way I think about consumer, their experience, obviously there is a technology point where you can make better apps, it can be delivered by drones. Hopefully there's nobody standing down there shooting them down so they can get free supply of medicine. But the one other aspect of consumerism that is becoming more and more important, and I know a majority of the people even in this room have that experience and have that pain point, which is more than 60% of health plans today have high deductible offerings. And what that means is there is an HSA somewhere built into your plan where you are out of pocket for a long, long period of time before the insurance kicks in. And in that situation, you essentially have become a cash-paying customer. And if you're a cash-paying customer, you honestly have no idea how much you're being charged, by who, and when. And so you have now, not even if we are covered by some of the best insurance products in the industry, either by the government or otherwise, we still are becoming more and more consumers that have to pay out of pocket. And Amazon can make a material difference in making the price for cash completely transparent, making sure all those rebate mumbo jumbo is gone, making sure the access is available through drones and all the other available technologies. So you have a choice. And by the way, by law, in many states, a pharmacist cannot tell you that you are going to save money by buying your medication on cash when you show up at a CVS. It's against the law and contract. And there is a big thing going on in Congress where they want to stop this. But many, many times, even if your copay is $15, you can get a cheaper medication if you decide to pay out of pocket.
And no one can tell you. It's crazy.
Tell you.
It is crazy.
So I wanted to come back to this point. Someone mentioned the home, and I think that's really important just because of, many of us in this room have an Amazon Echo. Our Alexa talks to us, sometimes in creepy ways. And I had a question from the audience about social determinants, things like poverty and housing. And recently, I wrote a story about Amazon having an interest in aging technologies and taking meetings with AARP, an Amazon vice president speaking out and saying that the problem of loneliness is one that they've fixated on and thought about. And that surprised me a lot because I assume that what Amazon is thinking about is healthcare pricing and the B2B side, but this is a company that talked about loneliness one of the few times that they have discussed healthcare. So let's talk about that. How do you see Amazon taking a role in sort of improving people's lives and not just the healthy, but the sick and they're vulnerable as well?
First of all, Christine, we know that 50 to 70% of all healthcare costs are the result of unhealthy living. And a lot of that, unfortunately, is a result of social determinants. It's not necessarily the people in this room that don't have access to information about diet, nutrition, exercise, and stress. And that's one of the great underestimated areas. And I think chronic disease, which many older people have, should be treated from the home, not from the clinic. And I think that's where Amazon and others, it won't just be Amazon, can come in and provide a lot of tools to really help people.
And they have Whole Foods. Let's not forget that. To your healthy living point.
Sometimes called whole paycheck. I mean, this is not going to solve the problem of the food desert in a lot of inner cities. Yes, the Whole Foods, maybe they'll move it that way, but that's a long journey they got to take to get. But I do think, though, we've got to help people in the lower income segments that are really struggling with their health. And I think Amazon and others will come in and give more information. People stay at home. There'll be devices in the home, so you'll have a sensor, you'll have a product hooked up to you, so you know your blood pressure, you know all the metrics, so your doctor can measure your home. That's something at Mayo we're pushing very hard, and it works. Telemedicine works very well. We don't necessarily get paid well for it, but that's what's going to happen. So we should stay at home, not have to come into the clinic, but that's where an Alexa or other tools can really help us.
And I think loneliness is a really interesting place to create a doorway to build trust. And I think with everything we see in the news today with Facebook, data and trust is becoming more and more and more and more important for these brands and more of a liability. And so how Amazon manages trust with patients, with their medical data and their personal lives is going to be really important.
And do healthcare companies trust Amazon? Is that something that you've thought about? Or?
I would say that people have, from every sector, a rather large amount of distrust of Amazon. Just they've destroyed the local bookstore. They've taken out a lot of different local any name your local corner store. So I think that when Amazon comes into an industry, I think everyone pays attention. But coming back to the elderly, I don't know what the Amazon Echo installation is in people over 70. I actually don't know. I don't know by socioeconomic class. I do think that AI for speech is critically important for that segment, but whether or not they have these products in their home today, I'm unaware.
No. But there are a lot of online tools, Christine, to help you with loneliness. I mean, we work very lot in this through our foundation. There's tremendous number of opportunities through guided imagery and other things that you can do. So it's not just Amazon.
Yeah. So, I mean, in our business today, we work with employers to help them choose the right PBM using technology. And what we are seeing is that behavior health is becoming one of the top areas of investment from employers. And when you think about that, the way I think about the Alexa conversation with Amazon is they're trying to figure out how they can deploy that platform to improve behavior health of their employees and their dependents. So I think they can have a real good play, but again, it comes back to they have a group of people, in my opinion, in my experience, who are trying to figure out what they can do with what they have quickly enough to make it a B2B solution, not necessarily a B2C solution.
So we should mention one of the things that Amazon has talked about, although we know very little about it, and that's the Amazon, JP Morgan, and Berkshire Hathaway consortium. The latest that we have just from our reporting at CNBC is that the CEO search is still well underway, and there have been some candidates that have been brought in. It seems that Berkshire is leading this at this point. So can we talk a little bit about that? Where do we see this going? Do you think it will be successful? Because this isn't the first time that employers have joined up to do something like this.
Well, all these employers, these three, but most major employers are self-insured. They represent, Faisal works with them, they represent a huge potential to change healthcare. So far, the CEOs haven't been very interested. That's why I'm delighted to see the CEOs interested here. But the number one thing is let's improve our employees' health, because every dollar spent on healthcare by a company is self-insured. You spend $2 on lost productivity. And so I think it gets back to having your employee base be really healthy and productive, not have mental health problems, and be really sharp. If you're running a big outfit like Best Buy, you want your people to be sharp on the store floors, for instance. So I think they'll have a big movement there, and I think they're going to bring a lot of other companies along with them who want to sign on when they get a really good offering.
Who do you think should be CEO?
Who do I think?
Are you ready for the job?
No, I don't think I would qualify, but no, I don't know. You guys got an idea for CEO?
I actually don't know.
Huh?
No.
I mean, I know a few people in this audience I think it'd be terrific. I'm not sure if they want the job.
It's a tough job reporting to 3 billionaires.
Yeah, very tough. And 100% travel. So
agree.
you could just leave your family behind.
But what I think is kind of ironic in this is honestly the, that's hilarious. I just caught on to that. That is so funny. I actually think this is a page out of Walmart's book. Like this is, that's the irony of this. Walmart has over 1 million lives.
2.3, I think. Almost double the number of employees.
Almost double.
The consortium.
They created the Center of Excellence program to be able to negotiate bundles for fixed surgical events or for oncology. They have done this. This is the negotiate down price for your employees, make it zero out of pocket, again going down to deductible, to change behavior at the consumer level, and to try and disintermediate pricing at a local level. So I'll say this as a Bay Area native. You know, the price of getting a surgery at Stanford is very different than at El Camino Hospital. And my employer needs to somehow manage that, and that's part of what insurance or your third-party administrator does. I'm so curious if Amazon in this consortium is going to really negotiate at a local level to intervene on medical expenses and cost. But the idea of aggregating demand and just negotiating, like the playbook has already been written by Walmart. We've already seen this for years. And we already know through their data the engagement levels of getting people all across the country of many different socioeconomic classes on a plane to go to the Cleveland Clinic to get a hip replacement.
And that's right. They do send their complex patients to Mayo for certain disease. I think it makes sense. But when you talk about cost, you can't just look at the cost of getting a new knee. You have to look at the total cost
Totally
of care.
agree. You're absolutely right.
That's what you're not looking at. That's where someone like Faisal is going to help them look at that and then figure out, and I say get to a major center with very high volume and have your employees, if they have to fly there, drive there, whatever, but not in a rural hospital.
Not a rural hospital.
That's got to change dramatically, and I think employers can drive that change to keep their employees healthy because they want them on the job. You don't want somebody out for 90 days, they have a bad back and they have pain. Let's get them treated. Not with opioids, but there are many other forms of acupuncture and meditation and other things people can do.
And at this point, we should probably mention technology because that they did, in the sort of very vague amount of detail they gave us, say that they think technology could be a way to lower costs. And Amazon has done that in other areas. Are we thinking telemedicine? Are we thinking AI diagnostics? What kind of technology do you think?
We already have, Medtronic already has complete systems for heart failure with implantable devices, and it gives you total readings on, all your readings on EKGs and everything else. It can be monitored from a central station from a hospital 100 miles away or 10 miles away. And I think you'll see many sensors coming to measure, so people can stay at home. That's the whole key. And then when they need a major procedure, please don't go to a small hospital and have it done where you have to have it redone. Go to a major center. Take the effort to do that. And people so far don't move to do that, but I think employers can push that. And I think they will, and I think Amazon will push that.
So, taking that example of Amazon and technology, there are so many technologies that are already available. I mean, we have $100 billion wastage just of middleman's margin just in the cost of pharmaceutical goods. So just creating a marketplace would be a huge step forward. And this Amazon consortium with 3 other companies, we are a small little company, about 100 some employees. We have 8 million lives under management, 8 million.
There you go.
So it's not even, it's like 16 times bigger than what Amazon has done today. So the real potential for Amazon is to aggregate a lot more demand, but to restructure how supply chain works. Just working with the same constraint, improving on current paradigms of contract is not going to get them anything that they're looking for. So I'm all going out for using technology to improve the supply chain and re-architect it, and there are plenty of ideas to do that.
That's great. So if anyone has any last remaining questions, we have a few more minutes. But I wanted to ask, imagine if half this audience was Amazon's healthcare team, which would probably be about the right size. How would you, as sort of panelists here today, advise them? What would you say, do this, don't do this? Kind of what are some of your big picture thoughts about where they should go?
Well, I think we've been very clear. I think on the distribution side, they need to cut out all the middlemen, get transparency of prices, and get it to me directly and get it to the end user, or maybe it's everyone between the Merck and the CVS stores. But they've got to help us do that right away. And maybe at our drone delivery, they got to present that. The second thing, he's got 8 million people, they've got 1.1 million. They've got to aggregate a lot more employees, but then they have to help them. It's not just enough to aggregate the employees. They actually have to educate and help the employees live healthier lives. And that is going to be a huge contribution to healthcare if we can get that done. And we can do it much more efficiently.
Anything that you hope that they don't do?
What I hope they don't do?
Yeah,
try to come into the healthcare business. Have hospitals hire 200,000 primary care doctors. I think that'd be very foolish because I think that's going to dissipate. I think we're going to move out of the clinic for primary care doctors and into the community. And you might have a doc in the box at CVS, but I hope they don't do that because Amazon's never proven they can do that. They can't do it in consumer electronics, so why do we think they can do it in healthcare?
Great point.
I agree with all of those points. To make it very clear, find a great use case to build trust with consumers, and that might just be with a very high-priced generic drug and getting out of the PBM structure and having a fixed price. And I think something very simple like that, even though the state-by-state regs on drug distribution is complex and how you get a pharmacy license and all of these bells and whistles behind the scenes, I think these guys can do it. So find a great simple use case that hits millions and millions of lives and show that you really are going to be working on behalf of people like us versus just the businesses.
So you said what should they not do? She just said trust. They better not sell my data. They better not sell problems about my health. They better not even, I'm not sure some of that may be a little confidential with my employer or on my resume. Yep. So I just think if you want to have trust, they better not pull a Facebook.
Yeah, and think about how much they already know about us, even more so than Facebook, perhaps.
They have to protect that information. Apple does a pretty good job of that, but Facebook is openly selling it. Well,
that's a whole nother panel discussion.
No, but seriously, I want my whole healthcare system sold. I know it's against the law under HIPAA, but I want to be careful that trust. bond is not broken.
We don't want them to pull a Facebook on us. So the very, very simple advice I would give to Amazon is, you guys are big enough and influential enough and resourceful enough. And more importantly, anything that you do in healthcare is not going to disrupt any of your business lines. A lot of very, very smart people work in healthcare. Some of the smartest people I've met work in healthcare. But the reason healthcare from inside can't be disruptive, because for commercial reasons, we are not comfortable or not ready to change our revenue streams. So if there is anything Amazon can do, is to not try to improve a broken and a perverted system, is to actually change the system. And they can start small, but don't try to optimize on the edges. You have an opportunity to replace the architecture. And that would be my advice.
And I think they ought to acquire Faisal with his 8 million employees and consolidate that and figure out how to do it right, because that's what he's doing.
All right, so Amazon should go big or go home.
Go big, go home.
Absolutely.
Very good.
Well, thank you so much for being on the panel today. We had a wonderful discussion. If anybody has any more questions, just come and find us. Thanks
All
again,
right,
guys.
Thank you, Christina.
Well done. Thank you.
Thank you.
Truly, good job. Thank
Thank
you.
you.
All right, is this Joe Biden Center, Cancer Center?
Yes.
Thank you. Well done.
Thank you very much, panelists. We appreciate it.